Hello and welcome to Healthwatch. I'm Dr. Vince Yelmy. On behalf of the physicians and staff at Ephrata Community Hospital, I'd like to welcome you to this segment. Today we're going to be talking about the painful hip, and we'll be right back after this segment.
The evolution of just treating a heart attack has been tremendous, but we see that in everything in all the subspecialties of cardiology. Ephrata Hospital is right on line with that equipment and is very good at staying up with the technology and all the new modalities and treatment options. I don't think there's any other place that I would feel I had to go to get better care. It's a nice feeling to take care of patients that way.
And welcome back to Healthwatch. Today we're going to be talking about the painful hip, and as we guessed, we have Dr. Tom Renz. Welcome back to the show, Tom.
Thanks, Vince.
Tom, a painful hip, probably a pretty common complaint as an orthopedic surgeon that you see, and a variety of different causes for that. And I thought today we kind of go through the spectrum. We all know about the arthritic hip as the baby boomers get there and the replacement surgery, but there's a lot of other reasons people can have hip pain. And I guess it causes you some quandary as an orthopod to be able to do that.
Well, that's right, Vince. You know, when a person comes to me with a painful hip, there's a big chasm between what a patient thinks of as a hip and what an orthopedic surgeon thinks of as a hip. So patients will think of the entire upper part of their thigh as being their hip and in their buttock area. And frequently patients will come in complaining of pain in their buttock radiating down the back of their leg. That type of pain is usually from pinched nerves in the lower part of the back. And from an orthopedic standpoint, we usually think of hip pain as pain coming from inside of the joint. And that type of pain is usually in the groin area. Recently, we've discovered a lot of new problems around the hip that's blurred those lines, and it's my job to try and sort out exactly where the pain is coming from. So I'm looking for sources of hip pain that are coming from outside of the joint versus sources of hip pain coming from the inside of the joint.
Right. Your workup, if you really suspect that that's what it is you get back x-rays, MRIs, those type of things to look at that.
Right, so the first thing, when somebody comes to me complaining of hip pain, the first thing I'm going to do is to take a thorough history and try and find out exactly where the hip pain is. And then after that, I'm going to do a physical examination. Again, trying to rule out the possibility that the pain is coming from pinched nerves in the back. I'll look at the back and I'll look at the buttock area. I'll range the hip to see if there's any kind of catching or pain on range of motion of the hip. I'll do, basic tests, physical exam tests like that. And then following that, I'll usually get an x-ray of the hip, frequently of the pelvis, and if I think it's coming from the back, I'll get x-rays of the back. That's usually the first step in the workup.
Right. The value of hip x-rays, I guess you can see the normal anatomy as relates to that, but we're going to be talking about some other things. MRI of the hip is also done. We do MRI a lot of things now. The value of MRIs, I guess, for the hip as far as a diagnostic tool.
Right. So, MRIs have been really very helpful, and over the last couple of years, they've gotten a lot better at identifying some of the more difficult to diagnose problems with the hip. Usually, if we're looking for things in the hip in a younger patient, we'd like to get an MRI arthrogram where actually dye is put into the joint, and that'll highlight some of the cartilage structures in the hip a little bit better.
Okay, so that if you're going to have that procedure done, that's the definitive way of doing it.
If you're looking for that for certain problems with cartilage.
Okay, and we're going to be talking about some of those issues.
That's
I guess
correct.
to kind of get into your work, we should really know what the normal hip looks like and some of the anatomy, because we're going to talk about some of the pathology in the hip that actually gives you that pain. So why don't you just describe for our audience a little bit what the normal anatomy does and how the physiology, how it actually works.
Okay, so this is a picture of a normal hip. And first you have the pelvis, and the pelvis is the major bone in your waist. All the muscles, or most of the muscles, arise from the pelvis and travel down into your leg. And then you have the femur, which is the thigh bone. On the top of the femur is a ball, which we call the femoral head, and that ball has a nice, shiny, smooth cartilage cap on it. The ball articulates with a socket, which we call the acetabulum. That's the socket. Surrounding the socket is a lip of tissue, which is called a labrum, and that labrum acts like a suction cup and helps hold the hip in place. That's the bony and cartilage anatomy of the hip, and then of course there are a lot of muscles and tendons and such and ligaments that attach to the structure.
Now the hip is a kind of a ball valve type of, or a ball acetabulum type of process. It has a physiology of its own. I think we have some examples of that, how it works actually.
Right. Well, the hip is a ball and socket joint, and if we go to the animation, you'll see that this is a picture of a normal hip moving, and you see there's a nice clean flow of that ball sliding in the socket.
Right, so that's the way it's supposed to work.
Correct.
Okay, so you get people coming to your office now, and you're convinced it is really their hip. There is some problems like that. Is there a distinction? I mean, guy my age comes in, you're more likely to be arthritic hips after years of wear. But what are you seeing in the younger individuals that might give you some kind of a thought process as to what's going on?
Right. That's a good question. So if I have a young person, especially if they've had some type of trauma to the hip, who's complaining of pain in their groin and maybe occasionally mechanical kind of symptoms, and what I mean by that is like a clicking or catching feeling, and I examine them and I find that there is catching on range of motion in the hip, then one of the things that I'm going to think about is a tear of the labrum, which is that lip of tissue that goes around the hip. Now, x-rays will really not show me anything, and the way to diagnose that is to get an MRI arthrogram, and we alluded to that earlier, and that's where you actually fill the hip joint with dye, and then you get the MRI, and that really will distinguish the labral tears better than a standard MRI.
Yeah, it's pretty accurate as far as the
it is pretty accurate.
Sensitivity of the study?
It is much more so than it used to be. It used to be that the accuracy of that type of study was, maybe 15%, and now it's much higher than that.
Do you ever do diagnostic arthroscopic when you're really not clear?
Yeah. I mean, that's not my next step, though. I mean, sometimes I'll see a patient for a while, and I just can't figure out why they're having pain in their hip. And I'll actually stick a needle in the joint and fill it with dye to make sure that I'm in the joint, and then put numbing medicine and then sometimes some cortisone in the hip. By numbing the inside of the joint, if the pain goes away, then I'm pretty certain that the problem's actually coming from the hip joint.
Okay.
Occasionally, even with that, you're still not sure what the cause is, yet there's a strong suspicion that it's coming from the joint, and in that case, a diagnostic arthroscopy would be warranted.
It occurs to me that we all get bursitis at one point in time. The bursa, the lining cells, and it's inflamed. Certainly had it in my shoulder playing ball, and you can get it in the hip.
Right.
How common is that? And it's certainly something you'd want to rule out. It's not a mechanical thing necessarily.
Well, that's a good question. The bursa, what a bursa is simply a sac of tissue. Anywhere in the body where one plane or one maybe layer of tendon is rubbing against bone or another hard structure, your body tries to protect itself by making this little sac, and that sac makes a small amount of fluid, and it's a very slippery, lubricating tissue. And sometimes when somebody has repetitive trauma to that sac, it'll actually thicken, it'll scar, and then the person will have pain. So in the hip, there's a band that begins on that pelvic area that I mentioned before that travels down to your knee, and it passes over the outside part of the hip joint and rubs against the thing which we call the trochanter, and that's that big projection on the side of the femur. Right in that area, there's a little sac, and that sac will sometimes get inflamed. So the person who has that type of problem would present with pain on the outside part of their hip.
Okay.
It would be particularly severe when walking. And the treatment for that is usually a cortisone injection to the hip and some hip strengthening exercises. And sometimes that'll take care of the problem.
Okay. Great. Good thing to differentiate. We got to take a break. We're going to come back and talk about some of the other more common issues that you see in hip problems. We'll be right back after this message.
It's who we are. It's what we do. And it's certainly what we know. Tires, any brand, any style, any size for any car or truck. We can get you what you need, when you need it, and get you back on the road. 4 tires, 20 minutes, no problem. From purchasing to installation, it's fast, it's simple, it's just what we do. And we've been doing it for the past 29 years. We're the tire consultants. Our customers think we're the experts, and we know you will too.
Another scorcher today. Hazy, hot, and humid.
Just when you thought it was safe to get your air conditioning serviced.
I'm back. What are you doing?
Here's the problem. There's nothing cold to drink. It's hot in here.
I just got that fixed.
But now you need toilet paper.
Avoid the nightmare. Get to know Cocalico. Get to know quality.
Welcome back to Healthwatch. We've been talking to Dr. Tom Renz about painful hip, and we talked about some of the more common issues, bursitis, back differentiations, and then we talked about the labrum tear. Now we're going to talk about something that I think you're seeing and recognizing more often, this hip impairment syndrome. And you want to kind of describe that to me. What is it, and what does it look like?
Sure. So this is actually called femoral acetabular impingement syndrome. That's what we call it, femoral acetabular impingement syndrome. And what that really means is that the hip joint has developed a deformity, which is pinching another part of pinching on the pelvis. So we have this animation here, or this photograph here, and this shows a picture with an abnormal hip. In this case, the person has both a pincer lesion and a cam lesion. A pincer lesion is a bump that's on the cup side of the joint, and a cam lesion is a bump that's on the ball side of the joint. And what happens is, as the hip moves, those two things will bang against one another, and that will cause pain. So if we have an animation here that actually shows the hip going through motion, and you see as these two structures collide, that causes a pinching and that causes pain. In addition, the cam lesion causes the ball to roll abnormally in the socket, and that forces the cartilage to press harder, the two cartilage surfaces to press harder on one another, and actually can cause the cartilage surfaces to break down. So it's not just simply a pinching that happens on the edge of the joint, it's actually something that happens in the joint.
Yeah, just step back a little bit. Why do we get these